Welcome to Shh, Tell Me Everything. Hi, everyone. Welcome today to another episode of Shh, Tell Me Everything. I am your host, Kristy Pack, and I am so excited to be joined today by my good friend and someone I look up to so much, Cindy Kelfer. And I can't even wait to hear what Cindy's going to share with us. She is somebody that I have known for, I think almost 7 years now, and um, is absolutely brilliant and skilled in so many ways. But every time I meet with her, like my thoughts go wild because she has so many powerful things to share. And so we'll get into that. I'm gonna let you speak for yourself and share those things. But Cindy, will you just give us a quick little recap of you? Like, give us a condensed version.
Absolutely. So just like Kristy said, my name is Cindy Kelfer, and I live in North Ogden. I am born and raised in Salt Lake City. I am a registered nurse, and I have been a registered nurse almost 18 years. It's so crazy to go back and do and look at pictures of when I graduated. So I graduated as a registered nurse in 2006, and I started off working in the cardiac ICU as a new grad and just started taking care of really sick patients immediately because I had already worked in the healthcare for a really long time. I had a passion for trauma and ER and got all my advanced certifications and did my time to be able to apply as a flight nurse. So I actually spent some time living in Alaska where I was a flight nurse for a fixed wing company based out of Anchorage. That's where my son was born. And then my journey just took me back down to the lower 48 to Bullhead City, Arizona, where I dived back into the cardiac cath lab because I missed the heart. And then just got burned out as years went on, got burned out of the healthcare system, studied more functional medicine, had some personal things happen to me with a family member in the healthcare system that I was just like, what is happening here? Thought of ways, just wondering why we weren't preventing diseases, what was going on. And just that's where my focus led to where I am today. I own a medical clinic with my amazing sister, Mindy Wade, who's a nurse practitioner. It's based out of Kaysville. It's called Balanced Body, Integrative Medicine and Beauty. And that's where my life kind of and journey is in a nutshell, where I am today.
And I know it's like it's a famous story now, but like I have literally seen Cindy save someone's life. We were at a business meeting one morning, probably 5 years ago, at a 7 a.m. meeting somewhere, and one of the participants of the meeting had some type of an episode, and he passes out, and it's something happens, and then like just like that, here comes Cindy from flying across the room straight over, and she's in like ER mode. She's fixing the problem, barking out orders, helping the guy. Like it was amazing. Like we all stood there, like, okay, we want Cindy to stay here. Wherever we go, we need Cindy to come. So
I knew exactly what to do because I had seen it so many times in my career. And I felt grateful that I could be of service that day.
Well, none of us will ever forget. And the person was fine. Cindy helped. This was great.
Yep,
So
it was good.
happy ending. It worked out good. Okay, so
Okay,
and
funny that
I
you remember that.
Oh,
Not funny
no,
that it happened to him. No, but just that it's still talked about to this day sometimes.
That's because for most of us, if we don't have a medical background, like we haven't seen trauma, we haven't seen things happen that
Absolutely.
need emergency medical care. And so for a lot of us, like, oh, that was weird. We're going to remember that one forever.
Yeah.
And grateful that we had you there and that, man, your instincts were fast. And it's been fun. I've also known Cindy all these years and seen her not only like professionally and how she's been weaving and building and the business that she has now. It's been absolutely wonderful to watch. I just have loved watching where you're going and trying to follow along. Yeah.
It's been a fun journey.
We're learning so many things. Okay. So,
Yeah.
okay. Well, we've invited you here today and we talked about this a little bit. There's so many things that I would love Cindy to talk about that I know that she is so expert on and that could help us. And I have given her the very difficult task of picking one. And so I've asked Cindy to share one thing with us today that has made all the difference. And I told her it doesn't have to be at work. It can be work. It can be something very specific to your skill set, to your professional life. It could be with home, with family, with a model. I don't know what it is. Like, but something that you have figured out or some secret that you've now learned that has made all of the difference, and to teach us that and to share a little bit about the difference that it's made in your life. So, Cindy, I'm going to ask you now to just tell us everything. Tell us the thing. I can't wait to hear what you have to share.
Oh, there was a lot to try to narrow down, but I felt this one resonated most with my heart and mine. I want to be able to just discuss navigating the hormonal journey, especially like in your 40s through empowerment, through understanding and support. And that's where I feel my clinic, Balanced Body, is so unique, is that it is founded by my sister and myself, who are we're both healthcare professionals. My sister, Mindy Wade, is a family nurse practitioner, and she and I bring on such a unique collaborative team together because we truly are in the rut of like things that are happening. And even more specifically, my sister, if I can share a little bit of
Sure.
story
Yeah.
and background about her, we both graduated from Salt Lake Community College in 2006 with our associate's degree in nursing. And my sister graduated about 4 months before I did. We ended up getting a scholarship through Salt Lake Community College. Intermountain Healthcare back at the time had partnered with Salt Lake Community College just to get some of their workers through their education. And so you had to apply for the program, and it was pretty competitive. And my sister got in the 4 months cohort before me, and I continued on with my trauma and my flight nursing and all of that fun stuff and just raising kids. And she continued her education, got her bachelor's degree at the University of Utah in nursing. And then after she was done with that, she was like thinking about wanting to have kids. And I think she was around 25 years old, and she started trying and she couldn't get pregnant. And so this kind of goes into the discussion of just being able to, your hormonal journey. With my sister having this diagnosis of not being able to get pregnant at 25 years old, she actually had a diagnosis of premature ovarian failure. So her eggs that she had just weren't very good. And she actually went through 8 years of infertility treatments, actually went through 8 rounds of in vitro fertilization. And she
Mm.
finally, on her very last try, did have beautiful baby twins. They're gorgeous. We love them. They're 8 years old and rambunctious and fun. After she had her babies, she's just the hardest working woman I know. She was like, okay, I'm going to do it. I'm going to go to grad school. So she applied for Westminster, and she got into Westminster's nurse practitioner program when her twins were 1. She worked
Insane.
full time, twins 1 years old, and went to Westminster and graduated and did amazing. So my sister is just such a warrior. She's just a very compassionate nurse, practitioner, provider. She's been so at the age of 35, after she gave birth to her twins, she was in full blown menopause, full blown menopause. So for her, hormone replacement was crucial because once you go through that transition and at such a young age, it can lead to debilitating long term chronic diseases that she was already suffering. And she was like, I cannot be this way. And so after she graduated as a nurse practitioner, she continued on her education and got more education in functional medicine. And now that is just like the main thing that we specialize in. Truly, our clinic is so unique because when I'm going through this transition right now, and wow, it's a 10-year transition. And it's those perimenopausal years that are so hard to manage. And what's unfortunate about it is there's not a lot of medical research out there. We're getting more, but there's truly not a lot of information on perimenopause and menopause. And these things, like even menopause and perimenopause, can be detrimental to women as we're transitioning. And boy, I had no idea what it could be until I met you 7 years ago, and I was doing this functional medicine, and I did not know that things were gonna get as bad as they did for me 7 years later. Wow, I've had some emotional roller coasters with my hormones.
Because even the word perimenopause, like I probably only heard that word like 2 years ago, and I'm like 40 now. And when I think of menopause, even then it's like something like, okay, no one's ever talked to me about it. That's not something we talk about. Oh, that's like my mom who's
Exactly.
like 70 who just complains about hot flashes. That's the
Yeah.
only like concept. And I'm like a fairly educated, I feel like pretty with it person, and I have no idea. Like
Absolutely.
I have no like what are you even talking about? Like I don't even
Right.
know.
And see, I think when doctors go to medical school, they don't study this in school. They really don't study the hormonal reproductive system and the long-term side effects of these hormones that are declining. And so just through my journey, when I first started hormone optimization, I was about probably 35 years old, but I did notice some things at 35 years old. And mind you, if what we do know is that perimenopause, we have that for 10 years before we reach menopause. So if you start having perimenopausal symptoms at 35, you have those for 10 years. So if I started at 35, my onset would be 45. So we're now seeing the data is showing that the average age of menopause is between the ages of 51 and 52, but we are seeing women all the time between that 45 and 50 that are in menopause. And so
Which means that
it's
perimenopause for a lot of people really is starting younger,
starting
35,
younger. Yep,
mid
it's
30s. It
starting
really could
younger.
start.
Yep. It's so crucial. Really, like the healthier that we are, the data does show that when we can delay menopause, we delay those cardiometabolic diseases that are so detrimental to women. We know that the number one silent killer in women over the age of 50, combined all cancers, is cardiovascular disease. And we do know there's a direct correlation with us hitting menopause. What happens is everything starts to go chaotic. Our triglycerides, our HDLs and LDLs all go out of whack. We know that estrogen is crucial for our heart. We know that it helps keep our blood pressure good. We know that when we start to lose our estrogen, we start to break down our bone. Being in the healthcare system for so many years, it's detrimental for a sweet little our grandma to take a fall and break her hip.
Mhm.
And so it truly is so important to navigate these hormonal changes so that we're healthier in the long term. But the research out there is showing, even for perimenopausal women, I only needed progesterone and testosterone and some thyroid. But as time has gone on and I've aged, I just all of a sudden started developing tremendous brain fog. My mental health started deteriorating. I mean, anxiety, depression, irritability, my bone pain, like every
Hmm.
bone in my body, I felt like I had arthritis. I didn't know, I thought I was going crazy. I really did. Um,
Or dying. It's one of the two. I'm either
yeah,
totally nuts or I'm dying because
right.
something's wrong.
Absolutely. And, mind you, I started hormones at 35, but the pain and the depression and everything just triggered hard at 40.
Hmm.
And after dealing with this chronic frozen shoulder pain, I'm like, someone diagnosed me with something, chop my arm off. It's hurting all of the time. Everything was fine. Great. It's perfect. MRI, everything's good. I was just on TikTok, scrolling through TikTok, trying to disconnect.
Right?
And I came across a physical therapist who had a talk about how many women she was doing physical therapy on who were referred to her for frozen shoulder. And so the thing with frozen shoulder or these joint pains is these injuries come on without any sports injury. It's
Yeah.
like
There's
all of
no
a sudden
injury.
one
Like,
day
where
you're
was the
just like,
injury? Yeah.
why am I hurting like this so bad? Like excruciating pain where
Yeah.
my focus, I could not. Like it was just, I was hurting all of the
Okay,
time.
this was similar. This was me maybe 4 years ago when I had this crazy shoulder pain for like 6 months where I was like taking Advil like 3 or 4 times a
Yep,
day, like thinking, do I need surgery? And nothing had
right.
happened, but like something was definitely wrong.
And did you do an injury? Did you do a
No,
sport?
no,
Yeah,
nah, nope.
right. For me, I had done all of the things. I've gone to chiropractor, massage, like my sister even had to do Botox injections. Like it was all of the time chronic pain, rubbing like those lidocaine gels on it. Needless to say, this physical therapist said that a group of OBGYNs and orthopedic doctors all came together and decided to put these women who are having these pain on estrogen. and to see if it would take away their pain. And they did a group with and a group without. And the group that went on estrogen, they had a major
Hmm.
reduction in their musculoskeletal pain. What was great is that like I can call my sister, who is the nurse practitioner, right? We're learning things all of the time. And so I had asked her, I was just like, hey, so what are your thoughts? Do you think maybe I should go on some estrogen? She's like, it's not going to hurt. And so we started estrogen on me, but we do other forms of like I do my progesterone at nighttime because it has a calming effect on us and it helps us go to
Hmm.
sleep and stay asleep. Because what we do know is that when we're reaching this perimenopausal stage, our hormones are going so out of whack, our progesterone is declining, and our estrogen initially is going way up. And so when this is happening, we're getting anxiety, irritability, we can't sleep. You have night sweats. You may wake up with like feet pain, low energy, low libido. But as things progress, we used to just give women in like just menopause estrogen. Well, now what we do know is that there's kind of two things going on is when we're born with a certain amount of eggs, and we do know that by the time we reach our 40s, we're down to like just 10% of what eggs have left. And we're born with 1 to 2 million of them. Only have like 10% left. But the 10% that we have are really bad, poor quality. Are you are you
Yeah.
following me?
Yeah. Yep.
And when we're having periods as women, our menstrual cycle, it's actually pretty regular, like an EKG of a heart. We have these rise and falls of our estrogen and progesterone, and it's very normal and it happens all of the time. But what ends up happening as we're aging and these are the less that we have, the quality are worse. But what's happening in our brains is our hypothalamus, there's a little sensor in our hypothalamus that says, whoa, 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 we're low on estrogen, and it sends out a signal down to the pituitary gland to say, hey, your luteinizing hormone and your follicle stimulating hormones called your LH and FSH to like go down to your ovaries and say, give us more estrogen, because we are very sensitive to estrogen in our brains and our control system, and we're not getting it. And what we're noticing is that we do know that those cells, because that's essentially what they are when they die off, those cells actually help release extra hormones like estrogen, but they're bad quality. So your brain's just so confused because it's just like, hey, I told you to do something. And the pituitary is like, I know, I did what you said, but you didn't do what you were supposed to. So it's this chaos. Does that make sense? And so what we're seeing is like when we're having these low dips in our estrogen, even though so what happens is our periods get chaotic. Are you following me?
Yeah. Oh
Like
yeah. I'm
they're more
following.
irregular, they're shorter, you skip a month. And so the onset, of menopause, they say menopause is the day that you stop having a period to not having one for a whole year. But we do know that there's so much other chaotic things happening in that perimenopausal phase. So the healthier we can be managing it, the symptoms, some of the main symptoms that we see with perimenopausal women that we're getting a lot of new data on is cognitive issues. So we are actually seeing an increased rise in women with mental health changes because, like I said, the brain does not like all of that chaoticness when we're not getting that estrogen. And what we know is that it's really sensitive to estrogen, progesterone, and testosterone. And we see that when we don't get it, our levels of serotonin, dopamine, norepinephrine decline significantly by like 40%. And so we have an increase in mental health disorders. And the data shows across the board that the increased use of antidepressants double. We also know that women that are given estrogen, like even during perimenopausal, if they have new onset depression, we know that giving actual estrogen is better than giving an antidepressive depressive
Hmm.
medicine. So there also is that cognitive thing that I told you about, where all of a sudden we cannot focus anymore and we start to develop like ADD like symptoms. Like we used to be able to focus, and then all of a sudden things are just like all out of the place. Like you
Yeah.
used to be able to do a task and you like cannot complete it. So we have a rise in actually ADD because of perimenopausal symptoms, because of the cognitive decline, because our brain is so sensitive to estrogen.
Well, and you and I have talked about that. That's something that I've seen. I've seen the mental fog, and I've seen like the ADD and things that I wouldn't have even thought in my head that, hey, this is perimenopause and that this is hormone related. Like I didn't even notice until I start looking backwards. And like I look at me over the past 6 months into a year, and I have found that where I usually could be so focused and productive, now for many tasks, I need a body double, which
Yeah.
is a tactic that you would use if you have ADD, you know what I mean, to help you accomplish things, and then I can do it, but otherwise I can't stay on task. And it's things that I didn't put the pieces together until talking to you, being like, oh, all these things that I'm experiencing, like maybe this is perimenopause, right?
Yeah.
Like these are like, and the good news with that is like if those things are that, then that's helpful because there's things I could actually do then, right? It's not just like
Absolutely,
I'm just burned out. And,
really
yeah.
taking note of how you're feeling. So here's the deal, because we get so busy every day and we chalk it up to all of the things we have going on, right? But just knowing, like even for me, like as it progressed, it got worse, and it got frustrating for me because like I couldn't do things that I could do before,
Yeah.
right?
So
And so what's amazing about this is that, you know, I can call my sister, who now, mind you, she was in full blown menopause at 35. So the sweet girl was already dealing with all of these symptoms, right? So if perimenopause is 10 years, I mean, it was all through her infertility
yeah.
journey. She started perimenopause at like 25,
Yeah.
pretty much. So she saw this chaotic thing going on. And so what is so nice is like I will call her up and I will explain anything to her, like sister talk. And I'm like, this is going on, and this and this and this and this. And she is so empathetic, where she's like, it's okay. This is normal. This is what you're going through. And we look at things. She'll reevaluate my blood, or we'll look at things and we'll take some accountability about how is my sleep habits? How am I doing with my stress management? Because we do know during perimenopause, there's a lot of things that we can do, like in this last part, to help manage it better. Because even the data, like I just heard another study that 1 in 4 women will quit their jobs because of like menopausal symptoms.
Mhm.
Like that's big.
Yeah.
There's depression.
Which
There's
we're probably not
suicide.
labeling it or menopause or
We're
menopausal
not.
symptoms. We're saying no, I'm
Right.
burned out. I can't handle it. It's too much. Whatever the things, you know what I mean? Like we're calling it something
Yeah.
else.
Right. And so just like the symptoms, they're the mental health, but that's like anxious, loss of that executive function. That's where that ADD type symptoms go up, the cognitive brain fog. You lose words. You can't do calculations at work that you used to be able to do.
You were like you were totally describing me. They're like, yep, that's me too. Yep, that one. Yeah.
Yeah. So, just like, I know there's a lot that I said, but I guess my take home message is, if you're a woman out there between these ages and you just see all of a sudden just like depressed, you just don't have a drive to do anything anymore, and you go to your primary care, they'll work you up and they typically will say, well, everything's fine, and try to hand you an antidepressant. We practice differently. We actually optimize hormones. And so we look at the patient individually. We do comprehensive blood work, but we're not only just optimizing hormones, we're looking at nutritional deficiencies. We're looking at anemia for those perimenopausal women who are bleeding really, really heavily. I mean, we even see teenagers who have severe PMS. We see the moms, and then they're like, can you help us with our daughters? We see women who have severe PMDD. I noticed that as I was getting closer to menopause, my PMS is getting worse, like my irritability. And so, even just for me, I can say to my partner, because their education's getting out there. And even my sister, who's my provider, I'm chatting on the phone with her and she wants to talk business and I just needed downtime. And it's really important to be able to take those moments to say, I need to shut everything down and I just need to be.
Yeah.
Like I just need to be present. I need to sit here and just listen to my music and play with my rocks.
You do have some great rocks. I have seen some of the rocks that you have collected of the crystals, and they're amazing.
They're so fun. And again, that was part of my journey through this perimenopause is truly finding in and leaning in who I was and
Yeah.
finding an outlet of like who I was and what I liked to do. I mean, who knew I liked rocks so much?
You didn't
Until,
know,
like, I
right?
never knew until, like, my husband's into off-roading, and so he would always wanna go and take me to these dangerous off-roading places, and I got so scared, so I just started hiking more. So I got bored and started looking at rocks because 'cause we'd go to all these amazing places. So I just, like, started picking them up, and then
When
I started learning
I came
about
to your
rocks.
house once, and like inside there were like tables and tables of like folding tables put up and like the coolest rocks and crystals. I think you had just come back from a trip and you're like, we're looking at all of the rocks and the things that we found. Like it was really, really cool.
I know, I'm a silly goofball.
I know, I love
So,
it.
yeah, so just for me, it's just nice to be able to call my sister because I get that very empathetic. It's
Yeah.
okay. This is normal. We
Yeah.
can work on this.
Well, and
And
even just being able to talk about it, because like I was like I don't even have the words. Like I didn't know this was a thing. You know, this wasn't something
yeah,
that we learned about really or have an eye on. You know, to be keeping an eye out for. Like it's not even on the radar of things.
absolutely. And I think it's just because it's just, again, it's really not talked about, even
Yeah.
though it is now. There's a big movement that people are starting to talk about it now, but it's hard to kind of, talk about it just to like your regular doctor. And what makes it nice is that like when our patients come in, they really just say like it feels like sister talk. And
Yeah.
so,
Well, it's
um,
I think about it, it's like when I first started going to you, like, and who brought it? Maybe you even brought it up. You must have, because this is what's refreshing about you too. Is like you'll come and you'll just say the things where all of us like, I don't know how to talk about that. And I think it was something with
yeah,
libido that you had brought up. One of the
right.
first times when I came in was to help with my libido, which I didn't know was bad, and then I was, oh, it totally was bad, right? And like,
Yeah,
and it's just so refreshing to like have you help direct those conversations for some of us that don't even know how to advocate for ourselves because we don't
yeah,
even know what we're missing. Like we don't even know those things, but to be able to go in and have help with that. You know what I mean? Like, hey, what about these
right.
things? And recognizing that man, maybe some of these things that you're experiencing actually do have some solutions and some help. You know what I mean? Like some
Absolutely.
there's always things we just got to deal with, but maybe some of the things that you're going through, there are things that you could do that could really help those symptoms and the quality of your life right now. Like you're not
Abs-
just stuck in whatever this
abs-
is. Like there are some solutions.
Absolutely. I mean, we chalk it up because I mean, it is hard when you're in your 30s, you have these babies and you're working and you're moving and so you just chalk it up like I'm busy. That's why I don't
Yeah.
have a libido, but truly it's really important when you've gone, you're like, your husband's like, it's been like a month or two. It's important to be connected with your partner and so but not only for libido, we do know that testosterone helps with lean muscle mass. Women do need testosterone. We need a little bit, but not as much as men. We know that it helps with our skin. We do know that we for sure need progesterone. It has a calming effect on us. As we are aging, our progesterone goes down. We can't sleep. So if you're that person who you're exhausted all day, like you're wired but tired, or you have to take caffeine all of the time,
Mhm.
or you feel like you could lay down and take an afternoon nap, or then the moment you
Which
go to
makes
lay
me
down to
have
go
to
to
yawn.
bed, yeah, and then the
Yeah.
moment you go to lay down and go to bed, you can't fall asleep.
Yeah.
And your brain is just going, going, going. We do know that's progesterone declining. So if you take a little tiny bit of natural progesterone, we do bioidentical hormone replacement, you can sleep better. And we do know that if you sleep better, you can handle your stress better.
Mhm.
You'll want to get up and go to the gym because you're not so tired. We know that testosterone helps with lean muscle mass. It has a calming effect on men. We do know it helps with brain function and cognition. And we know estrogen is so incredibly important. It is like when we get that total reduction of estrogen, that's the cascade of diseases. I mean, heart disease, osteoporosis, dementia. Like we can prevent probably dementia by doing hormone optimization. Now, mind you, there's a lot of myths and a lot of misinformation on hormone replacement. There's new information out there that if people want to get up to date information, you can go on, I think it's the Northern Menopausal Society.org. And they give all updated information on perimenopause and menopause and how to manage it. And it's a huge group of OBGYNs and other doctors who put all of the new updated literature up there for people.
Okay, so Cindy, this has been fascinating. And it's like, I'm thinking about like, man, the secret is like, gosh, people like, you might be experiencing some things that you think are normal, and maybe they are normal, but there's help for them. Maybe they're not normal, but there are things that you can look at that maybe are a step beyond just Googling it, and a step beyond maybe what your normal family practitioner might have access to, that could really help you, especially when we're talking about perimenopause, because for most of us, that was never something that was even talked about or on our radar or anywhere. Cindy, I'm going to give you the last minute. I would love for you just to tell us a little bit about your practice. Share whatever you want for this last minute. The time is yours. Like, where can we find you? All that kind of stuff.
Okay. So again, Balanced Body, Integrative Medicine and Beauty. We are located in Kaysville. We specialize in medical aesthetics, anti-aging medicine, hormone optimization. We have a lot of amazing devices because just like I said, as we age, our estrogen declines. And as I've aged, I'm starting to just see my skin just sagging everywhere. So we have a device called Morpheus 8, which is microneedling with radio frequency. So creates a bunch of punctures in the skin.
That was the video that you shared, right?
Yeah.
Yeah.
So I did it last night. I should have waited. I just forgot.
Okay, but this is also what I love, Cindy, is that all the stuff that you've ever led me to do, it's stuff that you have done. You're like, I tried this thing. It helped me. Would you like to try it? I've done this. This is very interesting for me. Let me, see if it's something you're interested in. So I love that it's being led by women who are actually doing this and seeing improvements in their life from doing these things that they're now teaching and providing.
Yeah, I mean, I wanted the devices for myself. And so, we incorporated them into the clinic. So we have laser hair removal because we do know testosterone can increase hair on our chinny chin chin. So we have an amazing device for laser hair removal. We have things for tightening. We do weight loss at our clinic. So we do know that as we're starting to see a lot of people have big weight loss, they're getting the laxicity issues. So we have non-surgical approaches that are minimally non-invasive that can help tremendously with skin tightening. So we just do it all. More than anything, we love taking care of women who are just in the rut of it, because it's so rewarding to be able to have a couple come in, and one of our patients was like, you saved my marriage. Like, I hadn't connected with my husband in 6 months, and they are thriving in their marriage. It's so nice to hear people say, thank you for getting me out of my pain. Yeah. So,
I think I've said to my husband,
our passion is.
I think I've said to Jared on more than one occasion that it is way cheaper for me to go and have some hormone therapy than for us to get a divorce. And so it's saying a little bit funny, a little bit real, a little bit,
right?
But really,
it's so true. And when you don't have it, that's when you notice it. You're like, okay, I need it. Yeah. I was just kidding.
Yeah. Ha 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 ha.
Yeah. So. We just do a lot of amazing things there. And what is great to know is that it's really backed by a very respected, my sister is very well known through the Wasatch region. She's worked in intense departments. She has done hospice and cardiac, just like me, home health nurse, but she's been a nurse practitioner for almost 5 years now. And it just goes to show where she graduated from college is pretty amazing.
Well, and just the level of care. There's something nice about providers that come from nursing, and they're wonderful doctors too. You know what I mean? But it's I don't know. Sometimes it's a different path sometimes, and you end up with a little bit of a different connection sometimes. And I've really appreciated that. Okay, so I think we'll post the link. I think we can post the link with this too, so that people can find you.
So if looking for a gift for your partner, laser hair removal. or you just are interested in chatting just to see if your hormones are off or things just seem out of whack, please just give us a call. We'd love to chat with you and just discuss what options you can do out there.
Awesome. Well, thank you.
Yeah.
Thank you, Cindy.
Thank
And
you,
by
Kristy. Thank
proxy,
you for
thank you to
having me
Mindy.
on.
Yes, you are wonderful. And thank you, everyone, for listening and tuning in today to Shh, Tell Me Everything. And we will see you next time.
Thank you for tuning in to an episode of Shh, Tell Me Everything. This podcast is proudly hosted by PackTax and produced by Techne Innovations. We drop new episodes 4 times a month, so be sure to subscribe and never miss out. See you next time, and keep those secrets coming.